Hi, my name is Xaviour Walker. I'm a geriatrics fellow and a public health and preventative medicine physician at the University of California in Irvine. I'm really excited to talk to you today about healthy aging. It's a topic I'm really passionate about, and I hope I can share some things on this topic with you. First of all, just have a disclaimer slide. So what exactly is healthy aging? When I think about healthy aging, I think about the spectrum of aging from when we are born until the day that we pass away, and really about optimizing the things that you want to do for your lifestyle, increasing meaning and potential, and increasing the lifestyle behaviors that will make you live actively and doing the things that you want to do. When we think about healthy aging, I like to look at this graph. We all want to live with vitality for as long as we can. Unfortunately, different things happen, medical illnesses, and this can increase our disability, and we need more care within the hospital and so forth. Well, what we want to do is move that curve to the right. No matter what age you are, is really trying to increase the different things that you can do to increase your well-being and ultimately your mental and physical well-being. If we look at Orange County by population, by age group, and this is the same goes for all the places in the United States, we see that the elderly over 65 is only going to grow and projected in 2030 to be quite a large part of the population. And if we look at Orange County by area-wise, we also see that the longer you live is also really related to your social-economic factors. So though we're talking about healthy aging, it's really important as a clinician to think about the other social determinants of health, the economic reasons that really could try to help your patient, because this has a massive underpinning. And we can see this in a lot of different areas around America as well. So this is from the Orange County Health Department. And if we have a look at what people over 65 are dying from, it's mostly chronic diseases. If we look here, 8 of the 10 causes of chronic diseases. Most chronic diseases are preventable, or we can reduce the age at which these develop. This is why it's so vitally important when we think about lifestyle as interventions to help reduce chronic diseases and morbidity. And if we think about those chronic diseases, what causes those chronic diseases? This is a fantastic paper from JAMA, which talks about 5 of these things. The top 5 are diet. So diet is crucially important. Not smoking, reducing your blood pressure, you don't have high blood pressure, not being obese, high body mass index, and having a low physical activity. So as we can see, those causes, 8 of the 10 causes of chronic diseases and mortality in Orange County, and this is very similar across the United States. If we look at the 5 top things that are preventable, these are the things, and they're totally modifiable, and this is what I'm going to talk about today. When we think about health, a lot of the times we think about just counseling and education. Really, this is a great slide from the CDC. Health is like a pyramid, and at the base, you make the largest impact to the smallest impact at the top. So we really want to think about making things easy for our patients, making it the right choice by default. And that's looking at interventions, long-term protective interventions such as screening, changing the context. So this is where you might be changing the environment, say even in their own home, to make the right choice the easy choice. And then the socioeconomic factors, which is a little harder. We're talking about education, housing, inequality, but you might be a spokesperson for your patient and looking at trying to change policy, which can affect the health of your patient and their well-being. I want to just take a little bit of a tangent and talk about a really exciting project that was done in the 1970s in Finland, in a small place called North Carolina. In North Carolina in the 1970s, they had the highest rates of heart disease in the world, really staggering. And they looked at community interventions to improve this. So what did they do? They looked at different things of their diet, and they measured their cholesterol, their blood pressure, and they had a lot of statistics, and they looked at community interventions. They realized they were having too much butter, they were eating too much meat, and they weren't doing enough exercise, and also having high rates of smoking. So as you can see that field picture, that's rapeseed, which is a vegetable oil, and they substituted that instead of butter. They increased the amount of vegetables people ate, and this was actually by teaching the woman to cook a vegetable stew instead of the traditional meat stew. They had a healthy heart label on all the foods that were healthy in the shops. So it just gave people the right choices, just to know that someone had gone before them and gone through that. And they looked at a lot of ways to making the healthy choice the right choice. And what were the results? Well, they went from the highest levels of heart disease in the world to reducing, through community interventions and things that we can talk about, reduce the cholesterol, they reduced the blood pressure, and ultimately not only reduce heart disease, but also cancer rates. This is a dramatic slide. If you look at the start in the 1970s, at the start of this project, and then 20, 30 years later, remarkable reductions in mortality and morbidity. And this project actually was not only rolled out through the whole of Finland, but is what actually has been developed in other parts of the world. So this is something that we really should look about, because it's really amazing, the different things that they've achieved. So what about data in America? The longest study of adults in America is called Baltimore Longitudinal Study. This is through the National Institute of Aging, branch of the NIH. And they've looked at people since the 1950s and followed them. And they've followed all these different aspects of what they do, how they live their lives, and their medical conditions, and ultimately how long they lived. And what did they find? They found that people are more sociable, they're generous, and more goal-oriented. They actually live happier lives, and they're less depressed. Those involved in hobbies and activities have less health problems. Vegetables and less saturated fat, you have decrease in cardiovascular disease, and they found many benefits of exercise. Another way of looking at this has been done in what's called the blue zone research. These are areas of the world where people live extraordinarily long lives, and not only long lives, they live independently and they're very active, right even up to over 100 years of age. These areas include Loma Linda, which is not far from us in Southern California, Costa Rica and Sardinia, and Icaria in Greece, and Okinawa. And they looked at different things that, looking at some reasons why these people live really long and healthy, productive lives. There's many things I could talk about the blue zones. A couple of things come to mind. They were very family-centered. And this is really important when you think about patient care, that how vitally important older people are for our families. And those who are isolated, it might be thinking about their different community, how we can get them involved and not isolated. Really focusing on not having a patient smoke is really important. And each appointment talking about smoking, ways you can get stopped, is vitally important. And we know all the different health effects that can help. Many of these areas in the world that were blue zones were a plant-based diet. And what I mean by that is majority of their food come from plants and natural things. They had very little meat in their diet, or they had the size of the meat consumption was actually very low. They exercise, but they exercise in a different way, which is really called moving naturally, constant, moderate activity. They didn't go to the gym. Actually, most of the areas in the world were very poor. So it's actually about getting active in terms of doing your activities around the house, walking places, and getting amongst a group and just being active. And finally, social engagement. You know, you've got to have fun and you've got to enjoy living. And the more we can, especially when people get isolated when they're older, is getting them engaged in different activities, which I'll talk about it. So I would like to just talk about 5 things that I think are very practical things you can bring healthy aging into your clinic as a patient, going into a clinic and asking through for your doctor or your physician how you can do this. One is having purpose and meaning. This is vitally important. When we think about the Okinawans, the women that live the longest in the world, they have a concept called ikigai. What's my reason for getting out of bed in the morning? You have to have purpose and you have to have meaning. And if you're going to do an intervention, you have to be able to motivate that patient. So spend a bit of time, get to know your patients, and really find what motivates them and how they can increase their meaning in their life. When we also think about purpose, we also think about people and downshifting, connecting with people and enjoying the environment. We know from the Baltimore longitudinal study that being positive is a very good thing. So being generous, volunteering might be a great way to do it, but helping other people really live much more positive, and also with that social network, because that will help to motivate you. We live such busy lives, so taking time out, maybe a day a week, time to reflect on different things, going to church, if you're religious, spending some time with family. But this is a great way to connect, and those who are working, connecting with relatives and older people. Finding some quiet time in the day for yourself time, meditation, or really time to reflecting is really powerful as well, reducing the stress. We know stress is inflammatory, and this is a way to really just reconnect. Second thing I want to talk about is the fundamentals: eat, move, and sleep. It really comes down to that, and I want to talk to you a little bit more in detail about these things. When we think about eating, eat whole foods, mainly plants. When I talk about whole foods means not processed and as naturally as you can find them. Really something that your grandparents would recognize. When we talk about plants, these like vegetables and salads, things that are really good for you. Fruit, nuts are also great as well. So that's a really simple sentence that you can talk to your patients, or really have the concept when you're doing your groceries as well. So going in a bit more detail, we talked about removing the processed foods, drinking water. There's so much sugar that goes into different juices, into our sodas, and you really can get a lot of empty calories from that. Keeping hydrated is really important. So a lot of our patients actually don't drink a lot of water, so try to get them 6 to 8 glasses a day. And this will help with constipation and their general well-being. When we talk about healthy lifestyle, try to get the commitment before you go to the grocery store, making the grocery list, write down what you need to get, and really focus on getting those things instead of going to the grocery store hungry and then getting what you really feel like. And this is a good way of actually what we call recommitment. Having a clean and uncluttered kitchen is really important. You know, if you've got things that are messy, it won't really motivate you to cook. So if you've got a nice, appealing kitchen, just making your own food is really good. Often when we're hungry, having pre-cut options in the fridge is a great option. So look at what you can do in the morning to make some options for your snacks later on. Bringing your own lunch is a really good way of knowing exactly what you're getting in your food. When you eat out, you really don't know what's going in your food. Extra salt and extra calories, and really that's a way to really control your thing is by eating your own lunch. In the workplace environment, those of your elderly people who are still working, or those of your patients that are younger, talk about healthy options. Talk about having some healthy things in the fridge, or making it a more appealing place. Moving naturally. Health is not just about going to the gym or walking, which I totally support, getting that 30 minutes of exercise a day, but it's actually about not being sedentary. We've turned into a society where we spend a lot of time on the computers, all of us, and we want to try to activate it, whether you do spend a lot of time in the computer, just getting up every 20 minutes, an hour, taking regular breaks, taking that lunchtime to walk around, in the weekends and the evenings, doing chores and being active. And we think about movement, getting on a morning routine. It's really hard when you live a busy life, trying to squeeze things in. So the morning routine can be really vital, getting that exercise into your day. We've talked about workplaces as being a place of getting a right environment. So talking to your colleagues and different things about having an environment that is really conducive to movement. When I think about falls reductions and general well-being and exercise, I think about three things: balance, strength, and fitness. With your patient, we often talk about fitness, but we neglect balance and strength. So maybe talk about a balance class, a strength class, or even doing some exercises in their homes. A lot of these things can be overwhelming. So what I think about is micro habits, making it really small. Even just getting your shoes on and going for a 1-minute walk sounds so simple. But you want to make it so simple that they can't fail. You know, just doing that small thing, making that small change, and what we'll find, they'll get momentum and they'll be able to do much more. When you're, as a clinician, making these suggestions, be really specific. So if you want them to do exercise, how much exercise, when, and how? Being more specific then gives you a way to track that. And also, if you're a patient, being very specific to yourself exactly what you're doing helps immensely. And writing it down is the best thing. It sounds so simple, but training diary, you know, reward yourself. You know you're doing these great things and you can track them. The power of consistency is really important. Once you get on a roll, you don't want to stop. The first couple of days can be really tough, but once you get on a roll, you find that the days turn into weeks, the weeks turn into months, and then you just couldn't not see doing these healthy behaviors as part of your regular routine. And finally, you know, don't do it alone. Use walking groups, use activity groups, have a neighbor, have a friend, have some family. You know, really make this a fun time, maybe a catch-up, so a win-win situation. Sleep hygiene. Sleep is a really big problem for a lot of people, especially when people get older. So I'm going to talk a little bit about this. And I put a picture for a baby for a reason. Is when we think about sleep for a baby, we think about getting the best for them. But when we get older, we kind of neglect sleep. But this is really, if not more important when you get older, really making a routine for yourself. So you get up at the same time, you exercise in the morning, wake yourself up. After a certain time, you don't have caffeine, so it might be 12 o'clock or 2 p.m. And we have a lot of blue light in things we do today, on your computers, on your phone. So if you are going to use it after 6 p.m., take the blue light out, using a filter, which is often on our computers and a phone if you look up that, or even blue light glasses if you really want to read late at night. Think about the bed as a place just for sleeping. It's remarkable how many patients have a television in their bedroom and they're finding it difficult to sleep. Television's got to get out of the bedroom because this is only going to stimulate you and keep you more awake. The other thing is, think about a routine. Like if you have a young child, you think obviously something like a bath routine, and then reading, and then quiet time, then going to bed. Same when you get older. It's just getting in that regular routine where you know that, that you're getting the sleep. Having your bedroom set up, that it's nice and cool, it's dark, and it sets up the environment for conducive sleeping, and not watching the clock, just getting good, solid sleep. And if I have to think of a medication, I look at melatonin. Melatonin is a natural hormone that we produce through the pituitary gland, helps the circadian rhythm, and that can be given over the counter. And I think sleep hygiene and melatonin should be number one, first thing that you tune to when you have problems sleeping, rather than just medications, which can have a lot of side effects. The third thing, and the 5 things I think you can do in your clinic, or you can ask your physician, is the other thing is about socialization. Really talk, what ways can I get more social? We know when people get isolated, they have increased risk of depression, and they really are not as active as they can be. So getting connected with your friends, getting connected with family in the community, having a reason to meet people, might be volunteering in your local senior centres, but really getting involved is really important. And the 4th thing is optimizing the annual wellness visit. The annual wellness visit is a visit that over 65-year-old people are eligible under Medicare, and it's a great opportunity for you and your physician to really review what you can do. Basically, we look at your immunizations, make sure you're up to date with preventative things like your flu vaccine, your pneumonia vaccine, your zoster vaccine. Look at the screening, make sure you've got all your screenings to make sure you don't have any colon cancer, any other type of illnesses that are age specific. We look at falls risk, make things that we can do to increase your strength. We look at diet interventions, we screen for depression. So it's a really good opportunity both for you and your physician to really optimize this visit, and for a physician really to look at your team of how you can maximize this visit and get your patients into this visit. So if you're a patient, ask for that annual wellness visit because you're entitled for it. And one of the last things is leveraging community resources. None of us can do this alone. So really think about ways that you can get into the community. The simplest one is a senior centre. It's really amazing the different things that senior centres offer through exercises, even as simple as going for a meal. You could tell your patient 2 or 3 times a week, I want you to go and have lunch at the senior centre and really connect with people. They also are an avenue to the rich resources that you have in your community, whether this be Meals on Wheels, if they've got vision problems, the Brow Society, the Alzheimer's associations, those sort of things which really are a wealth of resources. So don't do it alone. Use your social worker, your case manager, or very simply if you don't have those people and you're in a clinic, is even visit your local health centre and just find out different things that you can offer your patients. And finally, when I think about change, and this is more coming from a physician's point of view, how can I make change? Or if you're a patient, what are the different ways we could change? I've talked a little bit about, obviously, on an individual level, we can make behavior changes, we can think about that. Also about change your environment. If you go back to that pyramid I was talking to, about changing your environment will give you more reasons to do things well because it's the natural choice. So whether it be in your clinic and workspace environment, whether this be in the Orange County level, changing the environment in terms of advocating for more healthy options, bike lanes or ways of having community parks or resources, or on a California or a national level. So it doesn't matter which intervention we look at, there's healthy aging can be tackled at lots of different levels. So advocate on these different levels because they really can make a difference. If you're a patient, advocate. You're the voice of healthy aging, and you really be able to advocate for different resources and different options in terms of having and living a healthier lifestyle. So just reviewing the different things, 5 ways that you can bring healthy aging to a clinic. First one, having purpose and meaning. Find the thing that motivates your person. What's the reason for them getting up in the morning? Finding some meaning and really activating them in terms of living a healthy lifestyle. 3 concepts with eating, moving, and sleeping. Eat whole foods, mainly plants. So simple, but it's so vitally important. Move naturally. Obviously, the exercise, 30 minutes a day, but try to move throughout the day. Get those steps in. Sleep hygiene, making a routine to make sleep a part of the routine, and it's just as important as other things you do in the day. Socializing. Make sure people are connected. We know we're social beings, whether it's connected to your family, your friends, your neighbor, but really use different groups and volunteering and different agencies. Really make socialization part of it just as important as a diet and exercise intervention. The opportunity of optimizing the annual wellness visit is vital. This is an opportunity under Medicare. Everybody under 65 is eligible for this visit. Preventable things like immunizations and other things. So really focus on optimizing this. And if you're a patient, ask your clinician to get a visit. And finally, leveraging your community resources. Whether you're a patient or a clinician, there is so much out there. And so much that you're entitled to that might be low cost or even free. So really start engaging and getting into those community resources. Well, thank you very much for letting me talk a little bit about healthy aging. It's such a big topic, but even if we start really small and some of these things we talk about, you can live a healthy lifestyle, and if you're a clinician, you can help your patients live a healthy lifestyle and help them age as best they can. Thank you very much.